Welcome to the Health and Community Services Union vodcast, and what a guest we have today. Judy Seal, nearly 40 years ago, became a dietitian, moved to Tasmania, and I'm so excited about going across the 4 decades plus also of your time in that field. And you've recently retired. You've been a HACSU member since the late 80s. There's so much to get through. Thank you for joining us, Judy.
You're very welcome.
What led you into that field initially?
Yeah, look, I was a bit science nerdy at school, and it was always going to be in the science area that I was going to do some more work. And I sort of looked at medicine and decided I didn't like the sound of the hours that young doctors were doing, and I thought, no, that's not for me. But I always knew I was interested in human wellness, and went to a lunchtime lecture at the University of Western Australia about, it was actually about fibre, and it was about dietary patterns and disease patterns worldwide, and the difference between places like Africa versus developed countries and the difference in disease patterns just really blew my mind. And I thought, this is really interesting stuff. I really want to study this. I really want to learn about nutrition. But the only way to study nutrition at a tertiary level in Western Australia at the time was to study dietetics. So I went and became a dietitian. There was only 7 dietitians in Tasmania, probably only 5 in the public sector, but there was only 3 of us at the Royal. And I arrived, and within 5 weeks of arriving, the other 2 decided that they had had their time in Tasmania, and off they went. And I became acting senior dietitian with 5 weeks experience.
So you step into this role that you didn't even anticipate. What was that like? What did you become responsible for?
Well, it was fascinating because I went and saw who was supposedly to be my boss, and that position was vacant. And so I actually reported to who was the medical superintendent. In those days, doctors were the head of the hospital. And I went down to her office. It was a female, and she said, well, this is the blind leading the blind, so we'll do the best we can. But the real challenge at that point was trying to attract a senior dietitian to come and work in Tasmania, because the wages that were offered to senior dietitians were less than what you could earn as a base grade on the mainland. And so attracting anybody to come was really tough. So I was asked to act in the position, but they didn't pay me at the senior level. They paid me at the top of the junior level, which was a bit interesting in hindsight. But they lent on me and tried to make me apply for it, and I said it was really inappropriate to put a new graduate in a senior position. So instead of doing that, I got in touch with the union and said we need to do something about wages for dietitians.
5 weeks in, you get this job, and already you can see the issues.
It took us a little while. I immediately rang a friend who trained with me in Western Australia and said, do you want to come to Tassie for a working holiday? And so she came over, and the 2 of us as new graduates basically ran the dietetics department at the Royal for nearly 12 months. Eventually we attracted another person down from Sydney, but again, a new graduate. So the 3 of us, were messing around thinking, how do we ever find somebody to come and be our boss? But I joined HACSU and made it known that there was a problem. And at the time there was a group called the Medical Scientists Association of Victoria who were connected to HACSU, and they were wanting to run a work value case for dietitians in Victoria, and they thought that it might be good to try and do a work value case in Tasmania and use us as a training ground kind of thing. So
this is all within 12 to 18 months of you moving to Tassie.
So
now you've joined HACSU. Now you're going for this work values case. Oh, please, what happens next?
Well, we had a full bench hearing for the case, and this is one of the points that I find really tricky. At the time, there was what was called a therapies wage, which covered the physios, the OTs, and the speechies. So there was a therapies award, and there was the dietitians award, which covered 7 employees. And this is a thing that I think we've got to really watch when we're looking at wages and wage cases, that there is safety in numbers. And if you allow small professions to get left behind, they really struggle. So while the therapists, so physios, OTs and speechies wages had progressed, at that stage the dietitians hadn't, because nobody had requested wage increases. So fortunately today we're all part of the Allied Health Award and we bargain together and the professions are bigger. But there are some very small professions still out there and we need to be really careful and that we look after the small professions because they can get left behind.
So you go in front of this board.
Yeah,
And
three commissioners and a health department person cross-examining me, and I've had 2 years' experience. It was pretty amazing. But look, I just told the truth. You know, we just talked about the things that we were trained to do and what we expected to be able to do, and took it very professionally, and we won the case. And our wages suddenly went through, well, not through the roof, but they actually became decent enough that we were able to attract somebody to come down and be the boss.
It's interesting, isn't it? Because you're seeing a lot of that now in other areas as well that HACSU is currently fighting for. Over that for nearly 40 years, you must have seen, what are some of those challenges outside of that and some of your highlights too? Because I can only imagine how much it's changed.
Yeah, look, you know, some change is evolutionary, isn't it? Like, not revolution. In fact, that was one of the questions that the health department cross-examiner asked me: is this revolution or evolution? And I've always believed that things evolve gradually rather than a revolutionary. So
were they trying to throw you a bit there, Judy?
I suspect they were, and in fact, the guy who was the medical scientist person afterwards said you gave the right answer then when he asked you about revolution versus evolution. But you know, things do evolve gradually, and when you're in it, you don't necessarily see the dramatic changes. But some of the changes that I can see today, when I started my current role, which I've been in for 30 years, a job at the time was called the State Nutrition Officer. I really didn't have government experience, but because the way management was at that time, and I was very fortunate to work with a very supportive senior manager who took me under her wing the day I started and took me up to the minister's office and said, this is our new State Nutrition Officer, took me up to the secretary's office and introduced her to me and made me feel like I had an important role in the department. I don't think that happens today. And I think what has happened is that because the workplace has become very risk adverse and very hierarchical, that there's been layers put in the hierarchy. So it's quite different. I suppose we've grown. The department has got significantly bigger. But I think it's become more hierarchical too. And I think that some of that's necessary because we have entered a very risk-adverse sort of environment. I think it's really important that professionals are enabled to do their job. You don't want the top brain surgeon worrying about budgets and whether people have done their mandatory training. You want them to be operating on patients' brains. And that's something that I think we're going to have to really work hard to preserve, because as management becomes the dominant paradigm, people question whether you should be that senior if you're not managing staff. And yet I think that some of the work that I've done has required a significant amount of brain power and expertise in another area. And I think I've been quite good at some of the work that I've done because I've been enabled to do that without having to worry about managing budgets and managing staff. So if I give an example of some of the stuff we've done, one of the really big pieces of work that we did, took us about 10 years to get there, was to look at mandatory fortification of folic acid and iodine in Australia. And we started working with what's known as the Food Ministers Forum and also the Health Ministers Forum. And so there was these big debates about whether it was Health Minister's decision or Food Minister's decision about who should make a decision about whether we should fortify the food supply. Food ministers had the power to enable it to happen, whereas health ministers needed to make the decision that it was a problem. So we were going up and down ministers' ladders. And if you look at the food ministers, that also includes New Zealand, so we're working across the ditch as well, and the rest of Australia, and trying to get all the other states and territories to agree at the same time. Because the Food Ministers Forum is a voting forum, so you actually have to get 6 of 10 votes across the line. So there was a lot of clever artwork that went into negotiating those sorts of outcomes. And you don't do that when you've had 5 minutes experience. You do that because you've got the science clearly behind you, you're clear about the evidence, but then you've got to start playing the games in terms of caucusing across the country and getting things over the line. We achieved it. It took us 10 years, but we ended up getting mandatory fortification of iodine in salt in bread and of folic acid in flour. And it took us a long time to negotiate that the principle around that was equity, and we wanted to make sure that everybody got the additional, whereas the food industry were very keen to just put it in boutique products, which would have meant that you would have had to advertise, choose the more expensive product, but we said no, it needed to be in all, otherwise it wasn't an equitable solution. And in fact, we've seen rates of neural tube defects come down in Indigenous communities in northwest Western Australia quite substantially since that has happened. So we've improved the iodine status of the Tasmanian population, of the New Zealand population, the whole of the southeast of Australia. The west didn't need it, but they did want the folic acid. And it was actually Tasmania and Western Australia, we worked collaboratively. They were keen on the folic acid story, we were keen on the iodine story. We joined forces and we made it happen. But it was not without significant backlash from the food industry because they didn't want to be told what to do.
Geez, you've been so busy. I feel like this should be a series of books or an entire podcast series.
It get very boring.
Not for me. I'm just sitting like, I could ask a question. I'm so entranced. But what do you do now? I know that you're an avid sailor.
Yeah. Look. You know, life has its stages, doesn't it? And I've entered that next stage of retirement, and I'm a very keen gardener. And we recently moved house, so I've got a food garden to create that out the back of my garden, and a native garden to create out the front because I like the birds. Probably a little bit of sailing to do, and maybe some travel as well.